Hello, everyone. My name is Barbara Sosa. I am a junior here in the public health major at the University of Florida. And today we will be talking about NOWS, or neonatal opioid withdrawal syndrome. So the National Institutes of Health actually calls NOWS a transgenerational echo of the opioid crisis. And I could not think of a better way to word this myself. So unfortunately, the opioid epidemic in the United States has developed into an overwhelming public health issue these past 30 years. By 2016, almost 9 out of every 1,000 infants was being born with NOWS. To put that into perspective, that's around 90 infants a day, or 1 every 15 minutes, who are born physically dependent on opioids and require different levels of care to wean them away from drugs. So one major factor that is contributing to the opioid epidemic is the current use of prescription opioids. The current opioid epidemic has resulted in a large amount of pregnant women using opioids, which has led to an epidemic of newborns being born with the syndrome. So NOWS is a condition seen in infants born to mothers who have used opioids during the course of their pregnancy. This causes the syndrome because opioids readily cross the placenta, causing the fetus to become dependent on opioids in utero. The symptoms include babies crying, having trouble sleeping or feeding. Their muscles often tremble, twitch, or even seize. They suffer from vomiting, diarrhea, which can cause dangerous dehydration. So they have to be under constant surveillance from the hospital staff. From 2004 to 2014, as seen in the first graph, the incidence of NOWS has increased 433% in the US, from 1.5 per every 1,000 hospital births in 2004 to 8 in 2014 per every 1,000 hospital births. From an economic perspective, as you can see on the second one, in 2014, we've spent $563 million just on cost of treatment from NOWS alone. 82% of these charges were actually paid by state Medicaid programs, reflecting that there is a greater tendency of mothers using opioids during the pregnancy to come from lower income communities. So for treatment, we use the Eat, Sleep, Console method for non-pharmacological treatments or without any kind of prescriptions. So how this is done is that the infant should be eating at least an ounce every single feeding, sleeping uninterrupted for at least an hour, and consoled within 10 minutes by a caregiver. This helps usually with their syndrome. For future goals that we have with neonatal opioid withdrawal syndrome, the first pharmacological intervention is we currently are examining the use of buprenorphine on infants with neonatal opioid withdrawal syndrome who require pharmacological treatment when the ESC method is not effective. Some future research studies are also needed on how NOWS affects cognitive, behavioral, and motor development, as well as academic performance during the adolescent years. We have some already in the toddler stage, but we don't have any for adolescents yet. And of course, we need community-based intervention. So there's already medication-assisted treatments for mothers with opioid use disorders, but we do need some other treatments set in place and some community interventions as well. So hopefully you guys can figure out some community interventions in order to help mothers with opioid use disorders. The NIH actually funded the HEAL initiative. It stands for Helping to End Addiction Long-Term Initiative. It was funded in 2018. And these two are new technologies being developed to help children with NOWS. The first one is a vibrating bassinet. The second one is a transcutaneous auricular neurostimulation device. Both of them basically stimulate the nerves in infants, giving them a sense of relaxation so that it can help with the ESC method. It goes hand in hand. Hopefully, we won't have to resort to using opioids as a treatment for them in the future. And these are my resources. Thank you so much for watching my presentation. I hope you have a great rest of your night.